Welcome to Strong from the Inside Out, Your Pelvic Floor Explained. Created by me, Taylor Wolfe. I am an occupational therapy student at St. Catherine University, and this presentation was developed for my doctoral capstone project for Regions Family Birth Center located in St. Paul, Minnesota. For my project, I developed a printed version of this presentation, as you can see here. So if you would like to view that and follow along during this presentation, you can scan the QR code on the slide. Okay, let's first talk about what are the pelvic floor muscles. So they're a group of muscles found between the coccyx, or also referred to as the tailbone, and the pubic bone. So these muscles support the pelvic and abdominal organs. Together with the abdominal muscles and the diaphragm, these muscles stabilize the trunk and provide muscular support for our internal organs. And as you can see, the two different pictures, so the top picture shows a top-down approach or view of these muscles. So the surrounding structure is the pelvis, and then the red structure in the middle are of the pelvic floor muscles. And then on the bottom picture, this is a side view. If you look at the very bottom of that picture, you can kind of see a curved line denoted as the pelvic floor muscles. So they really are the bottommost aspect of our abdominal and pelvic cavity. And then this QR code leads to a video explaining the pelvic floor muscles. It's a really great visual just to understand these muscles and how they function and what they look like. So what are the functions of the pelvic floor muscles? What do these muscles do? They support our pelvic organs like our uterus, our bladder, and our rectum. They also help us control bowel and bladder function. They're involved in sexual function like arousal and orgasm. And then they coordinate with the diaphragm and abdominal muscles during movement and breathing. Let's talk a little bit about the effects during pregnancy on these muscles. So as the pregnancy develops and progresses, muscles have to stretch, right? Abdominal muscles stretch out and the diaphragm shifts up, which can put an increased pressure on these pelvic floor muscles because they also experience increased stretch and pressure. This can lead to weakness and less bladder control as our pregnancy progresses. There is also a number of hormones that are released during pregnancy that can cause softening of the ligaments and connective tissues in the pelvis, which also leads to additional strain on the pelvic floor muscles. Think about it like ligaments and connective tissues are the structures that help hold our body together. And if those are a little bit weakened, then our muscles have to work harder to hold our body together. And then lastly, diastasis recti, which is a condition where the abdominal muscles can separate in the center during pregnancy, can cause muscle weakness, lower back pain, and pelvic floor dysfunction. Now let's talk a little bit about what pelvic floor dysfunction symptoms may look like. This can be difficulty controlling urination or bowel movements. So you might experience leakage or feel the need to urinate frequently or have trouble fully emptying your bladder or bowels. You might be experiencing pain in your pelvis or lower back or genitals. And you might be feeling a bit of heaviness or bulging in your pelvic area. And then the last one is pain or discomfort during intercourse. So many women can experience these pelvic muscle dysfunctions for a time after birth. This can be common. But if these symptoms are greatly impacting your quality of life or how you feel about yourself or are lasting maybe a year or two after delivery, talk with your OBGYN or primary care provider to seek out support. Now we'll talk a little bit about how vaginal delivery can impact your pelvic floor muscles. To deliver a baby through the birth canal, the pelvic floor muscles must relax and stretch. which can decrease muscle strength and function in the immediate days after birth and have lasting effects into the postpartum period. More significant vaginal tears during birth, like third or fourth degree, can affect the pelvic floor muscles and area around the perineum and anus. It's common to experience some pelvic floor symptoms afterward, but many people recover with support and time. And finally, the nerves that control the pelvic floor muscles can be stretched or compressed during childbirth, which can lead to temporary weakness or loss of coordination in the pelvic floor muscles until the nerves have time to heal, which may take weeks to months depending on the severity of the injury. Now let's talk a little bit about how cesarean delivery impacts the pelvic floor muscles and surrounding structures. So, though pelvic floor muscles are not as directly affected by a cesarean delivery as they may be during a vaginal delivery, the abdominal muscles go through a significant recovery process due to the surgery associated with cesarean delivery. Since the abdominal muscles play a key role in core strength and movement, their recovery is important for returning to everyday activities. Next, we will briefly go over some strategies to support your recovery. These strategies will cover diaphragmatic breathing, progressive muscle relaxation, and guided imagery techniques. Diaphragmatic breathing is a technique that activates deep abdominal muscles, stabilizes your body, and strengthens your ability to move your body safely. Gentle activation of these muscles can gradually increase muscle strength during activity. You can view a video on this technique below by scanning the QR code. To practice this technique, sit in a comfortable chair or lie on your bed or the ground on your back. Place one hand on your chest and one on your belly. Breathe in through your nose. As you do, try to feel the hand on your belly rising while your chest stays still. Breathe out through your nose and gently tighten the muscles in your belly as you exhale. Repeat this for 5 to 10 breaths. Progressive muscle relaxation is a technique that can help you manage nausea, fatigue, pain, sleep disorders, stress, and anxiety. To practice this technique, focus on a specific area or muscle group. Tense up your muscles in this area for a count of 3. Then slowly relax these muscles and exhale as you do. Try to notice the difference in this area after you've released the tension. Repeat as many times as you want, and you can also try this technique on your whole body. So start from the top or bottom and work your way up or down by muscle group and area, which can be really great for whole body relaxation. Guided imagery is a technique that uses calming or soothing images or sounds that can help you manage pain, stress, and anxiety. To practice this technique, make yourself comfortable in a chair or lying down. Breathe in and out a few times, and then use your imagination to picture a safe, healing space for your body. You might imagine certain sensations during this exercise. Another way to use this exercise for postpartum recovery is to focus your attention on your pelvis. You can do this with any part of your body, but that might be a way that might be helpful for you in this time of postpartum recovery. So imagine your muscles and pelvis receiving healing energy through an image or scenario you choose. You can use sounds or images to visualize healing in your body. Now that we've covered some basic strategies that can help you feel more in control of your body and manage your symptoms, let's talk about when you may need more support. Symptoms like leakage, pelvic pain, and uncomfortable sensations in your pelvic area can impact your quality of life. If you're finding yourself anxious about your symptoms, worried about leaving your house for more than a short period of time, or participating in a physical activity that you used to love because of these symptoms, it may be time to reach out for additional support. Many women think that it's normal to experience leakage or pain for the rest of their lives after childbirth, but I'm here to tell you that this does not have to be your reality. Unfortunately, there's a lack of research on the typical time frame of recovery for these muscles, but the general consensus seems to suggest that most women recover within 1 year. Due to the lack of research, you should not think that you must live with these symptoms for that long before reaching out for help. It is important to consider for yourself if symptoms are preventing you from doing the things you love or participating in activities that are important to you. If this is your experience, I would encourage you to reach out to your OBGYN or primary care provider to seek out a referral to a pelvic floor therapist. Pelvic floor therapists are qualified healthcare professionals who are trained in pelvic floor musculature and function. They can help you learn about what's happening to your body and how to help it with further exercises and training. The exercises and strategies mentioned in this presentation are really just a basic sort of guidance on resuming activity and trying to help your body recover. If you are wanting more rigorous activity for your pelvic floor muscles, I would encourage you to reach out and try to get in contact with a pelvic floor therapist who is specially trained in these muscles. Thank you so much for listening to this presentation. If you would like to view the references, you can scan the QR code here, and I wish you all the best in your recovery.